Welcome to the Village Talks podcast. This is a space where physiology meets lived experience, where we talk honestly about the body, the nervous system, relationships, and the real questions families are asking without fear-based narratives or one-size-fits-all answers. We're your hosts. I'm Dr. Jamie.
And I'm Dr. Brittany. We're chiropractors, perinatal specialists, and humans who work closely with families through preconception, pregnancy, birth, postpartum, and early parenthood. Whether you're preparing for pregnancy, currently pregnant, newly postpartum, raising a little one, or supporting someone who is, you're in the right place.
Let's get into today's conversation. Welcome to another episode of the Village Talks podcast. In this next series of episodes, we are going to be shifting gears a little bit and taking a deeper dive into very specific topics. Up to this point, we have hit a lot of different topics, but sometimes from a broader perspective. And we also think it's valuable for people to be able to access a lot of detailed information in a short amount of time about a very specific topic. So we're gonna start that today. Today we're gonna kick off with carpal tunnel. Carpal tunnel type symptoms in pregnancy, which we do see a fair amount. This usually is going to consist of things like numbness, tingling, or pain in the hands and the wrists. Oh, I didn't introduce myself. I'm Dr. Jamie.
Hello, everyone. I'm Dr. Brittany. Welcome back. Don't mind me and my raspy voice. I was on the beach in California visiting family and came back to smoky Colorado. So my raspiness is because my throat isn't used to all this smoke right now, ironically, coming from California for a little bit.
Yeah, it's been rough around here for the last few weeks with all the smoke.
It's crazy.
So, thankfully, for now, the smoke is not from our fires, so we're thankful for that. But, hopefully sending some moisture to those that need it.
Well, it's supposed to rain today, so hey, here we go. All right, let's get started.
Yeah, so
Carpal tunnel.
I think one of the things we want to touch on with all of these focused episodes, first and foremost, are big and scary and red flags. You know, as when we talk about what we see, what we assess, what we do, what we treat, we're looking at mechanical factors, neuromusculoskeletal factors, and then always through the lens of what can we do for nervous system regulation, if that is a component, which it often is, especially in pregnancy. So, some big and scary things. People probably don't think a lot about how could carpal tunnel or numbness in the hands be big and scary, but especially related to pregnancy, we're always taking into consideration blood pressure. If this pain is accompanied by sudden and extreme onset of swelling in the hand, in the arm, anywhere in the body, weakness, especially on that side of the body, headache,
blurred vision,
dizziness, any chest pressure, heaviness, pain, none of those are secondary to carpal tunnel. Your carpal tunnel is caused by something else. So for these episodes, we are going to assume that the big and scary has either already been ruled out by OB, midwife, or another provider, or they are presenting to our office. We have gone through and asked these questions on an intake. We are ruling these out through the course of our own intake, consult, and assessment. And if any of those things are happening, we're going to be making an appropriate referral.
Absolutely.
But what are some of the things that you hear patients reporting as they're coming in, right? What are they experiencing? What have they tried? What is or isn't working? What's happening by the time they get to our table?
Yeah, my favorite answer in the birth world. It depends. Yay. But there's a whole host of things that come in. Rarely do we have people coming in specifically for carpal tunnel only issues. We have people coming out throughout their entire pregnancy, whether they're experiencing pain, discomfort, or not. So a lot of it is wellness too, but we do see it manifest throughout their pregnancy. Usually I see it later in pregnancy, and I think maybe you do too.
For the most part,
yeah. When our blood volume increases, the demand and the load on the physiology of the body changes. And so sometimes that's one of the things that happens. Relaxin is also a big thing. So sometimes it's, well, when I go to bed, I wake up and my hands are numb, or they feel dead, or I feel that tingling and numbness throughout my hands. Maybe sometimes it goes up into my arm and into my elbow. Weakness in the hands, like we can't unscrew like the cap to our toothpaste.
Yeah,
and
the
things
fine
like,
motor.
Yeah, very fine motor stuff. Yeah. So that's typically what I see. A lot of it too is the swelling. That's like not emergent, but maybe like, let's take off our rings so we don't have to get them cut off, because I just had a patient have to do that.
Yeah.
But with that increased swelling, it does put pressure on those nerves. And so one, we lose those fine motor skills a little bit, and then also our strength, and then also that tingling and numbness. And it's not always in all of the hand.
Yep.
Sometimes it's in the thumb and first finger. Sometimes it's in, the last 2 digits. Sometimes it's right in the middle of the hand. So it is dynamic in what we see throughout the course of clinical, just looking at things. But that's typically what I see mostly. Yeah. What do you see?
So same thing, right? Sometimes they are talking about pain. A lot of times it is positional. So you talked about at night, hands are in this position.
Yeah.
If I change positions, if I shake out my hands, if I do whatever, it goes away.
Yeah.
So definitely positional. We'll start to see some of the weakness comes on over time when the pain or the numbness or the tingling has been present for a while.
Yeah.
So like you said, a lot of times it's not their primary complaint. It's something that they mention offhandedly during the course of a consult, or we've been seeing them and then it comes up as a new or progressing symptom.
Yep.
I think part of the reason it depends too is where is the nerve irritation coming from? Because at the end of the day, we've got nerve involvement when we have these types of symptoms. So classically, outside of pregnancy, carpal tunnel, true carpal tunnel, not any of the other things that often get mistakenly diagnosed as carpal tunnel, is happening at the level of the wrist and the hand. We've got a nerve compressed, or we have some entrapment right at the wrist, right? Yep. The symptoms are pretty classic in usually the first 2 fingers, sometimes a little bit the inside of that ring finger. We don't see pinky involvement. We shouldn't see thumb involvement, right? Yeah. Those indicate other issues. And so when we have patients come in, they're like, my whole hand. And I'm like, okay, well then it's not just your wrist probably, right? Like so then we have to kind of work our way up the chain. Like, is it the forearm musculature? Commonly, yes. Is it the elbow? Maybe. Is it the upper arm? Sometimes. Shoulder, good chance. Neck, a lot.
Rib cage.
Yes. Yeah. So it's like you kind of have to go through this whole path. Where is this nerve pinched, compressed, entrapped, or irritated?
Yep.
And there's so many different things that can cause that at any one of these points in pregnancy, because our body's changing, because we have inflammation, because we have swelling, because we have increased blood volume. So now your blood vessels are taking up more space that they share with a nerve.
Yep.
And so the nerve can get kind of pushed out of the way or become a little bit compressed.
Absolutely.
I have had a recent case that was, I think, a little more classic, where we have someone whose job is very, very repetitive, and she's a tattoo artist, so they classically have hand and wrist issues, not just from the entrapment, but also from the constant vibration. So these are things that can also cause irritation in nerves. So while she didn't have this issue outside of pregnancy, she started experiencing it in early 2nd trimester, which is a lot earlier than we would normally see it.
Yep. And I would say her posture too, just as a tattoo artist in general. In pregnancy, we build new mammary tissue, new breast tissue. So the weight on the front of the body up top, but then also everything. Like we have placenta, we have baby, we have extra fluid, we have a bag of water, like all these things. Yep. So the front side of the body gets pulled forward. Add years of being like this and doing this type of stuff, like it can manifest
hairstylists,
faster.
Dental hygienists and dentists, right? There are certain jobs where you're more prone to this, even if you haven't had it previously from a repetitive stress. And then sometimes I think you've kind of had a recent case where it came on, the mechanism is very different, right? It's not sort of what most people think of as a repetitive stress. But historically, we have some increased risk factors. Because I feel like, that for me was a little bit of a different type of a case. For most of my patients, they don't have a repetitive stress. They don't have a job where we classically see these symptoms, and they've never had these symptoms before outside of pregnancy. This is all brand new to them.
Yeah.
But we will often see that onset around third trimester, early third trimester.
Yeah. And that, like, what it makes me think of too is a lot of times we blame pregnancy for things that just seem to magically appear that we never had before. But when we backtrack and look at the history and take a look at what our lifestyle is and what we're doing every day and how it's changing or how it's not, as our body's trying to adapt to this very new thing that it's doing, oftentimes it's like, well, actually, you've had this pattern in your system for a really long time, and now pregnancy is asking something very different of you. And so these symptoms start to manifest in a way that they're like, oh, yeah, it's probably just because I'm pregnant. And I'm like, actually, we can do something about this.
Yeah.
And like sometimes what I've seen is when we start care earlier, these types of things that seem to just come on during pregnancy don't manifest as fast or as nearly as severe or anything like that, because we've been under care consistently and can help our body adapt a little bit better.
Or they come on, they bring them up, we address them quickly. We're giving them the tools to minimize or prevent. Sometimes they'll resolve completely. Usually we can at least, kind of stop them in their tracks so they don't get worse. So it's a little bit of both. It's like an ongoing prevention, because every time we see a patient, they're in a new body. And so it's
literally
like,
every day.
Yes. It's like, so what's new since the last time we saw you? And sometimes it's, we found out the gender of the baby, or that, sometimes that stuff. And sometimes it's, well, now I'm waking up with numb hands, there's always something new to report. And sometimes it's fun and exciting, and sometimes it's less so. But I do think that this is one where, outside of what we do, there's not a lot of active treatment that is offered. And so a lot of times patients are coming in and they've been recommended to splint. They've been told to change their sleeping position, maybe drink more water, some stretching. Every once in a while, I feel like ice gets suggested, but this is one where I feel like it's kind of like, oh, well, this just is what it is. You're just going to have to deal with this when you're pregnant. And
which is a lie, by the way.
We strongly disagree. It is very common. But it is an indicator that these nerves are being stressed in some capacity. More than likely, it's mechanical or it's musculoskeletal. So the things, let's just kind of hit on all the things that we're going to check and assess when a patient reports these symptoms to us. So what should and most likely look different from whoever has said, try some bracing and see if that helps.
Well, it goes into kind of what you touched on earlier, right, is the full assessment of the arm. Number one, we're going to take a history, detailed history, because we need to. But when did it start? How bad is it? Has it progressed? Has it gotten worse? Has it changed over time? What part of the hand, if it is the hand, is being impacted? What is our strength? We're looking at mobility of the hand, the wrist, the elbow, the shoulder, the cervical spine. We're assessing, did we have any trauma to our cervical spine? Are our pecs tight? Because everything coming forward here is going to potentially put some compression in that brachial plexus where those nerves into your arm and hand go. We're looking at, what nerve is it? Is it actually the median nerve? Is it the ulnar nerve? Is it the radial nerve? So there's lots of different things. It's not just one thing getting compressed. Sometimes it is. Majority of the time, I don't find that it is because it's like, well, I have some at the tip. I have it in the middle. Sometimes it goes like up here. So there's a lot of nuance to it. And so a really detailed history is super important to go in. And it's not just asking all the questions, but it's actually putting your hands on your person that you're assessing. Because oftentimes I do find when people come into our office with things like this, no one's like touched their arm or assessed the mobility of their wrist and their elbow and their shoulder and cervical spine and things like that.
And tried to elicit the sensation, whether it's through touch or, okay, well, let me have you, do some movements here or put yourself in the position, really get curious and explore and try to figure out what's the issue. Because like everything we do, at the end of the day, we can probably adjust it. We can release tension. We can regulate the nervous system. We can do all the things that we do in the office, but if they go home and they change nothing, we're probably ending up right back here. Maybe it's a day, maybe it's a month, who knows? But I do think this is one where posture is often a factor. What, through that history, do you have any injuries? Have you had this before? But also, what does your life look like from day to day? What position are you waking up in when your hands are numb? Like, can we give you tips or tricks or tools to change some of these things so that you're putting less stress into the body? That is a huge factor in reducing it, right? And so we have, sometimes people are like, well, I'm wearing the braces. And I'm like, okay, we've introduced this thing that has the potential to help, but you haven't changed anything else. And so sometimes that's not enough, especially if it's been going on for a long period of time. If it's gotten really severe, I would say it's my favorite answer on our entire intake form. What do you think has caused this issue? Pregnancy.
I know. Pregnancy is the problem.
Probably not. Pregnancy is what made you aware of this issue. Our body only has so much capacity for these patterns, right? Our bodies are really smart. We're going to try to complete the task by whatever means are available to us, but there's a threshold for all of it. And pregnancy usually challenges and pushes us past that threshold.
Absolutely.
And so now we have a symptom or a pain or a sign that there is something going on underneath. And from a mechanical and a musculoskeletal standpoint, it's usually not brand new. And so then that's where looking at these patterns and understanding the bigger picture of their history and their day-to-day is going to make a huge difference.
Absolutely. And it always brings me back. I always bring it up when I'm educating our patients about this is Bruce Lipton has a really great wealth of knowledge when it comes to conscious and subconscious patterning. Of the conscious mind of what we're aware of. I think he says we can interpret, it might have changed. It's been a minute since I've read his book, but it's anywhere from 40 to 60 nerve impulses per second that we're consciously aware of. Things that we're okay, I know this is happening. But on the subconscious level, things that we're not necessarily aware of, it's upwards of 60 million nerve impulses per second. Constant all the time. That your body
overwhelm essentially.
For a lot
right.
Of people. And we can only handle so much at one time. The body does that in a really smart way, but that's why sometimes in pregnancy it brings some of these patterns to light that you didn't know that you had beforehand, because your body is oh, we did this for a while, but what you're asking of me right now is no longer working. And so I need you to create some change. And this is how I'm showing you how to do that.
Your body is asking you for something, right? Pain isn't normal. We go over that again and again, not even in pregnancy. And pain is one of your body's last sort of desperate pleas for help. By the time you are experiencing pain, obviously fall down the stairs, injury, things that are new and acute, it's a little bit different, but it is because your body is look, man, we've hit the limit. We've done all we can. You're asking more of me, or now I've got this thing over here I'm dealing with. We need to get some help. Either you need to become conscious of this so that you can make change, or we need to get somebody else involved.
Absolutely.
And so I think from, hopefully people hear this, they're going to come see us, know that they have an option for these issues, or find somebody locally that can help them with this. But we also have listeners who don't have access to us or somebody that's going to be able to kind of adequately assess and manage things from a mechanical or musculoskeletal standpoint. I have some kind of tried and true things that I recommend. What are some of your favorite, say at home tools, or what are some things that listeners can do to kind of step in? Self-care is not the right word, right? And not even self-treatment or self-management, but just some things to start their own investigation of, is this mechanical? Is this something where I can make a change through my habits or through my actions?
Yeah, definitely. My favorite one, sleep posture. because I do it too. We all do this. And so this gets compressed. But then also when you have increased blood volume and everything like that, just changing that posture. And it doesn't have to be a wrist brace, which a lot of people are told to wear a wrist brace. But if you put a big pillow, not like a small, thin pillow, but if you do a big pillow where you can actually open up your chest, open up your pecs so you're not collapsed in this way, it creates such big change, and you don't wake up with like limp arms or you can't not being able to feel your hands, right? So a big pillow. And I have my thoughts about the big pregnancy pillows. They're not my favorite, but some people love them. It's great. I love that it works for them. But if you can just have a standard like body pillow and then just get one more to put that, so you create this big open circle, and this posture is going to be good throughout your day too, right? So not only sleeping posture, but posture throughout your day. Are you working at a desk? Are you slouching in your chair? Do you collapse in the front of your body? All of these things to be aware of. Yes, we're chiropractors, we love posture, but also from a functional standpoint, what are your muscles doing? Those are like the two places that I start. And then I love like Epsom salt soaks. Like if you have, I wouldn't say like major swelling, but like your hands are kind of painful because of that increased blood volume. And because
people are like, they just feel kind of, they don't look swollen, but the skin feels tight.
Or like kind of just like, they have lack of motion and things like that.
Little stiffness.
I always just say, get some warm water, put Epsom salt in it, and you could do it in like your big Tupperware pan or whatever, and just soak your hands in it and move them around a little bit and see how that feels. If it creates change, great. If not, then we're going to go up the chain.
We recommend Epsom salt baths
all the time,
relatively frequently. But I think what I find is that people are not keeping their hands in the bath. Their hands are out and they're on their phone. Or they're typing or they're reading a book. I'm like, I'm going to need you to put everything down and drop your hands and arms into that bath too.
Just be.
Yes. Like just listen to some music, listen to a podcast. We don't have to have a device or a book or anything in our hands so that your whole body is getting the benefits of the Epsom salts. I think that, like you said, posture is huge. So if you're not sure where to start, when do you have symptoms? Do you have them at night? You're going to start with that side sleeping posture, because a lot of people are not side sleepers prior to pregnancy, or the position they've been sleeping in and it was fine and suddenly now it's not. Yes, there are reasons for it, but now we also have to kind of come out of this position. There's so much flexion here. All of the tissues, the wrist, the arm, the shoulder, the neck, everything is in a shortened position here. And so then you go about your day and you open this up, and now we're tractioning the nerve, we're tractioning the muscle, everything's getting stretched. And, when you think about a rubber band, right, when it's in neutral, it's fine. When it starts to get stretched, it gets tighter. So we need to keep these tissues open.
Absolutely.
I think stretches are a really simple one, especially if you're at a desk job. There are just these certain positions. I'm like, you can stretch the top of the arm, you can stretch the back of the arm. Any kind of upper body, but especially chest opening types of stretches and exercises increases blood flow, physically opens up the space. One thing I often warn people is that temporarily, meaning seconds or maybe a minute, sometimes the symptoms seem more pronounced when we're stretching, because through this action, we can be briefly compressing. But then as you come out of it, now that compression or that tension is gone, and you are creating space in these areas. So if while you're stretching, you're like, oh, that now it feels more numb there's a zing, it feels more numb for a few seconds. Promise that's not permanent. It's not causing damage. But it can be a little bit unsettling when some of the things we're doing to supposedly help can also seem to sort of
trigger it,
exacerbate or trigger the symptoms.
Definitely.
I think this is one where, for my own experience with carpal tunnel in my first pregnancy, it did come on pretty quickly with some swelling, but there was a reason for it. I uber nested. I went crazy on a weekend, and I was doing a ton of fine motor stuff with my hands. I was doing scrubbing and cleaning, and babies live on kitchen floors, so why not deep clean? And I woke up the next day and my hands were slightly swollen, but felt like absolute sausages, tons of numbness and tingling and immediate weakness. I was able to rule out the big and scary, but was also like, I need to use my hands to go to work tomorrow.
Yeah.
And one of the things that really helped me was acupuncture, and it had to do with fluid. So I also immediately started onboarding some electrolytes.
Yeah.
There were a lot of things that I, of course, got my hands and wrists. I, of course, got adjusted.
Yeah.
But there were some other things because I'm like, I went from 0 to 100 and I need to go from 100 down to at least like 20 or 30 to keep working.
Yeah.
And so like, how much water are you drinking? How are your electrolytes?
Yep.
If we do not have sufficient electrolytes to move water and other things in and out of our cells and in and out of the interstitial tissue, the other things aren't really going to help.
Yep.
Yeah. So I think that's another easy one, is just making sure you're hydrated, making sure you're getting some electrolytes on board, and see if that makes a difference.
Yeah.
Yeah.
I love movement too. There's not like a specific type of movement, right? But making sure that you're staying active in your pregnancy too, watching those fine motor skills that you're doing every day, but doing these big global movements.
Yeah.
Super important too, and paying attention to what your rib cage is doing. Your rib cage has to flare and open up, and that creates compression up at the top as well, where that brachial plexus is. So sometimes that's what is the root of it, and the stem of where it's coming from. But making sure your rib cage is mobile, making sure that you can actually rotate and lateral bend and extend and flex, because those movements also impact what's happening at the top over here too. So anything, not just stretching, but I love mobility through things like yoga or Pilates, especially in pregnancy, because it's low load.
Yep.
It's not super hard on the body. It's giving you mobility with movement as your muscles are activating versus like a passive stretch, which isn't always a bad thing, but I really love being able to move through these dynamic planes of motion because it's important in pregnancy.
Well, and the key there being mobility versus flexibility. Right? The relaxin is going to make you more flexible. But mobility is that controlled movement where we're still protecting the joints underneath. But, you know, we look at this area too. We have tons of lymphatics in here. So it's bigger than just compressing the nerve, right? It's everything else. We have to keep this area open. Those larger movements are going to create space and lengthen muscle. They're also going to promote that fluid movement through there as well. Whereas stretching doesn't really promote fluid movement the same way that full body or larger global movements do. It can feel good in the moment, and then it comes right back. That's why, like, yes, passive stretching can be nice, but we need these other factors to help your body adapt better too. It feels good, but is it changing anything? Is it moving the needle? And that's often a question we will explore through an intake is, you know, what are you doing? Do you think it's helping? And sometimes people are like, well, no, but it feels good. I'm like, I get that. We're looking for feel good. It's probably not causing any damage, but if it's not helping, let's try to find something that is gonna make a difference here. Anything else you can think of that we want people to know about this specifically, either from a standpoint of who's going to help me with this if what I've already tried hasn't worked, or I don't have anyone to help me with this, what can I do on my own? I think we've kind of hit most of it.
I think we have like some of the practitioners, right? Massage therapists, acupuncturists, chiropractors, physical therapists, like they can all address that too if it does kind of have a sudden onset like yours did. And it does happen a lot in pregnancy where it's like you wake up one day and you're like, oh my gosh, what happened in my hands? So not hesitating to reach out for help. Sometimes it'll get better on its own. Sometimes it won't. In my thinking and how I would do it personally, I'd be like, I'm not going to wait to see if this gets worse or to see if it just goes away. Like I'm going to go do something about this. So finding that, YouTube is a great resource for different stretches and movements and stuff that you can do to help open up your rib cage and then also like hands and wrists and things like that. So for people who don't have access to a practitioner in their area, honestly, I love YouTube for that kind of stuff.
And get specific. Pregnancy, carpal tunnel, stretches in pregnancy,
Yep.
right? Like
Yep.
get super detailed. I also recommend YouTube really frequently. And they're like,
Yeah.
well, I don't have time to go to a yoga class. I'm like, no worries.
Yeah.
Look up 15-minute prenatal yoga video on YouTube. Like see what
Exactly.
you can find.
Yep.
There is great stuff out there. I think that, I think I just forgot what I was going to say. I think that's what just happened. I had
okay.
something world shattering to say. It may come back to me. It may not. What you said about like not waiting. So one of the things that we see frequently, not everything is big and scary and not everything requires intervention.
Yep.
But we rarely see things go away on their own or resolve during pregnancy because you're going to get more pregnant.
Yep.
The demands on your body are increasing. The stress on your body is increasing. Mm-hmm. So if this is super minor and you wake up on occasion with a little bit of numbness and you change positions and it goes away, great.
Yep.
If it increases, if it begins impacting your sleep, it's interfering with sleep, if it begins impacting your ability to do your job, to pick up your kids,
to take the cap off your toothpaste.
Yes, to drive safely.
Yep.
You know, if it's starting to impact your life, it's time to get somebody involved. Beginning of the episode, those big and scary things, you need to have somebody evaluate and rule those out.
Yep.
But from this end of it, if it is starting to impact your life, it's worth getting a second opinion or getting somebody involved that can help from a mechanical standpoint, like all the providers you mentioned, or begin exploring some of these stretches or movements, positional changes on your own, and see if they're going to bring you some relief.
Yeah. That's great. I
All
love
right.
it. So many things.
Yeah. Okay, so that's today's deep dive, carpal tunnel, hand and wrist, pain and numbness. As always, if there's any questions, any feedback that you have for today's episode, if there's something that you tried and helped, drop it in the comments. People love to see that. If you have any other questions about this topic, feel free to drop those in the comments as well. We're happy to answer them. Otherwise, join us next time where we'll take a deep dive on a different subject. Thanks for joining us today.
If you found today's episode helpful, you can subscribe, share it with a friend, or leave a review. It helps this podcast reach the families who need it most. You can find us at Belly Bliss in Denver and online for resources, workshops, and support. Until next time, take care of your body and trust its wisdom.